Primary healthcare, the day-to-day healthcare given by a healthcare provider. Typically, this provider acts as the first contact and principal point of continuing care for patients within a healthcare system, and coordinates any additional care the patient may require. Patients commonly receive primary care from professionals such as a primary care physician, general practitioner or family physician, a physician assistant, a physical therapist, or a nurse practitioner. In some localities, such a professional may be a registered nurse, a pharmacist, a clinical officer, as in parts of Africa, or an Ayurvedic or other traditional medicine professional, as in parts of Asia. Depending on the nature of the health condition, patients may then be referred for secondary or tertiary care. Primary health care, PHC, refers to a broad range of health services provided by medical professionals in the community. This means universal health care is accessible to all individuals and families in a community. General health care practitioners, nurses, pharmacists, and allied health care providers are exclusive components of the primary health care team. Basically, the PHC service is the process and practice of immediate health services, including diagnosis and treatment of a health condition, support in managing long-term health care, including chronic conditions such as diabetes. PHC also includes regular health checks, health advice when an unhealthy person seeks support for ongoing care. Primary health care, PHC, is targeted to ensure the highest possible level of health and well-being and their equitable distribution by concentrating on the public needs for a sustainable healthy life without any financial burden on patients. It is also explained how to give special preference to women, families, and rural communities on a priority basis. The most impressive part of this chapter is the role of PHC in handling the COVID-19 pandemic, which is still beyond perfect control. The World Health Organization attributes the provision of essential primary care as an integral component of an inclusive primary health care strategy. The WHO identifies 5 core functions of primary care, providing first contact accessibility, continuity of care, coordinated integration of various patient services, comprehensive access to a full range of services, and finally people-centered care in which individual patient feedback is received. It aims to optimize population health and reduce disparities across the groups by ensuring equitable access to services for all subgroups. Primary care involves the widest scope of healthcare, including all ages of patients, patients of all socioeconomic and geographic origins, patients seeking to maintain optimal health, and patients with all manner of acute and chronic physical, mental, and social health issues, including multiple chronic diseases. Consequently, a primary care practitioner must possess a wide breadth of knowledge in many areas. Continuity is a key characteristic of primary care, as patients usually prefer to consult the same practitioner for routine check-ups and preventive care, health education, and every time they require an initial consultation about a new health problem. Collaboration among providers is a desirable characteristic of primary care. The International Classification of Primary Care, ICPC, is a standardized tool for understanding and analyzing information on interventions in primary care by the reason for the patient visit. Common chronic illnesses usually treated in primary care may include, for example, hypertension, angina, diabetes, asthma, COPD, depression and anxiety, back pain, arthritis or thyroid dysfunction. Primary care also includes many basic maternal and child health care services, such as family planning services and vaccinations. In context of global population aging, with increasing numbers of older adults at greater risk of chronic non-communicable diseases, rapidly increasing demand for primary care services is expected around the world, in both developed and developing countries. Funding for primary care varies a great deal between different countries. General taxation, national insurance systems, private insurance, and direct payment by patients are all used, sometimes in combination. The payment system for primary care physicians also varies. Some are paid by fee-for-service and some by capitation for a list of registered patients. Strategies to address the primary care shortage. The Patient Protection Affordable Care Act contains several provisions to increase primary care capacity. These provisions are directed towards medical school graduates and include payment reform, student loan forgiveness programs, and increased primary care residency positions. The PACA also provides funding and mandates to increase the role of mid-level practitioners like physician assistants and nurse practitioners to enhance the primary care workforce. The PACA is projected to increase patient demand for primary care services. By adopting new patient care delivery models that include physicians working in tandem with physician assistants and nurse practitioners, the demand for future primary care services could be met. Consumer surveys have found the American public to be open to a greater role for physician extenders in the primary care setting. Policies and laws, primarily at the state level, would need to redefine and reallocate the roles and responsibilities for non-physician licensed providers to optimize these new models of care. According to a Fair Health analysis, 29% of patients who received medical care in the U.S. between 2016 and 2022 did not see a primary care doctor. Shared decision making. Involving older patients. There is currently limited evidence to form a robust conclusion that involving older patients with multiple long-term conditions in decision-making during primary care consultations has benefits. Examples of patient involvement in decision-making about their health care include patient workshops and coaching, individual patient coaching. Further research in this developing area is needed. All people, everywhere, have the right to achieve the highest attainable level of health. This is the fundamental premise of primary health care, PHC. Primary health care is a whole-of-society approach to effectively organize and strengthen national health systems to bring services for health and well-being closer to communities. It has three components. Integrated health services to meet people's health needs throughout their lives. Addressing the broader determinants of health through multi-sectoral policy and action. Empowering individuals, families, and communities to take charge of their own health. Primary health care enables health systems to support a person's health needs, from health promotion to disease prevention, treatment, rehabilitation, palliative care, and more. This strategy also ensures that health care is delivered in a way that is centered on people's needs and respects their preferences. Primary health care is widely regarded as the most inclusive, equitable, and cost-effective way to achieve universal health coverage. It is also key to strengthening the resilience of health systems to prepare for, respond to, and recover from shocks and crises. Universal health coverage will only be possible when everyone, everywhere can access the health services they need. Communities should be empowered to identify their health priorities and contribute to finding responsive solutions. Healthcare and other sectors need to work together to ensure all decisions affecting health are addressed in an integrated way. This includes promoting policies to protect and improve people's health and well-being, providing information, services, and infrastructure for improved water and sanitation and other environmental determinants of health, prevention of non-communicable diseases, preparing for and responding to health emergencies, providing services for pregnant women, routine vaccination for children and sexual and reproductive health services, mental health support, platforms for community consultation and many others. Primary health care brings these factors together to ensure the highest possible level of health and well-being and their equitable distribution. The impact is seen in health systems that focus on people's needs and are as close as feasible to their everyday environment. Primary health care-oriented health systems consistently produce better outcomes, enhanced equity, and improved efficiency. Scaling up primary health care interventions across low and middle-income countries could save 60 million lives and increase average life expectancy by 3.7 years by 2030. PHC is a comprehensive, multi-sector approach to care that is grounded in the belief that good health for all is not simply a matter of treating individual patients when they are sick. It is the most inclusive, equitable, cost-effective, and efficient approach to enhancing physical, mental, and social health and well-being worldwide. According to the 2018 Declaration of Astana, PHC is the most inclusive, effective, and efficient approach to enhance people's physical and mental health, as well as social well-being. It is a cornerstone of a sustainable health system for universal health coverage, UHC, and health-related sustainable development goals. The PHC system serves as the foundation of the health system by promoting health, preventing disease, and managing care. It focuses on making services accessible by delivering them as close to people's homes and communities as possible. PHC is a comprehensive, multi-sectoral approach to care that is grounded in the belief that good health for all is not simply a matter of treating individual patients when they are sick. Though there is variation across countries in the exact set of services delivered through PHC systems, they generally span preventive, curative, promotive, rehabilitative, and palliative care services. High-quality PHC is people-centered, accessible, coordinated, continuous, and comprehensive. With effective delivery of PHC services and prompt triage and referral to higher-level facilities, a strong PHC system can improve outcomes and health system efficiency. A strong, effective PHC system is a critical foundation for assessing and meeting people's health needs across the spectrum of services, age ranges, and populations. Regular and preventive health care delivered through the PHC system can catch illnesses early, which saves money in the long run. Countries with high-quality PHC services see reduced hospital admissions and lower rates of emergency department use. In countries with strong primary health care, PHC, systems, fewer children die before their 5th birthday and more people live longer, healthier lives. A PHC can also serve the role of master conductor of the health system, tracking, identifying, and managing care of patients, developing and monitoring personalized care plans, and managing patient communications no matter where a given patient is located. Because high-quality, accessible PHC gives health systems the capacity to serve a large and diverse set of health needs all at once, it can serve as the service delivery platform for approaches that are often disease-specific, vertical, such as tuberculosis or HIV treatment programs. The PHC system can also ensure that the system is reaching those populations most vulnerable or hard to reach. PHC plays a key role in ensuring access to essential health services for all, but around the world, people still lack access to high-quality PHC services. The COVID-19 pandemic has further exposed weaknesses in PHC systems and has highlighted the significant inequities that persist. Why? The challenges facing decision-makers in PHC today are complex and, in many cases, specific to the current context. However, there are a few broad themes. Primary health care is not adequately funded, and existing funds are not always spent wisely. Health system governance is fragmented and complex, leading to fragmented care for patients. PHC systems sometimes underachieve on clinical and experiential quality. When patients anticipate receiving low-quality care, they often avoid the system altogether. Challenges remain in ensuring equity of high-quality services. PHC systems must be resilient and flexible to meet evolving population needs. Thank you for watching this video.